Currently, the issue of drug addiction in the homeless population is an increasing problem which healthcare members in Regent Park are trying to address. There are many support programs that the Regent Park Community Health Center provides to the homeless population, such as shower and laundry support, housing support workers who aid by providing resources and advocating for those that are homeless or at risk of homelessness, and also men and women's drop-in programs as a harm reduction space and social engagement environment. To battle the crisis of drug addiction, the Health Center provides harm reduction supplies and social support, as well as supervised injection services. For the community to stay safe, needle drop boxes have also been placed in key areas. In a study done to examine drug use in the homeless population, it was seen that drug use was associated with unmet healthcare needs and access to addiction treatment. This shows that supervised consumption facilities are vital and do in fact help with the problem of drug use in the homeless population, as they allow for access to services to prevent overdoses and safe drug use.
Although the interventions currently in effect are beneficial, additional interventions are required. Activists and healthcare experts agree there is a need to move from a criminal justice approach to a public health approach. Substance use disorders can be treated with evidence-based treatment and social supports. Criminal sanctions are ineffective at preventing or addressing substance use. Community health nursing services should be listening to the voices of people who use drugs when planning care for those people, to identify the needs of that community. The COVID-19 pandemic has negatively affected people who use drugs, and the Canadian Association of People Who Use Drugs, or CAPUD, is advocating for decriminalization, at least during the pandemic. Drug policy should follow public health principles, emphasizing social protection and health care instead of conviction and punishment. Illicit drugs are contaminated, and the toxic drug supply is responsible for countless deaths. In order to promote and preserve health, a safe supply of substances needs to be established. Nurses and other healthcare providers need to advocate for safe supply programs. For example, CAPUD advocates prescribing Dilaudid and Dexedrine as safe pharmaceutical alternatives to opioids and stimulants.